People don't generally go blind because of cataracts in this country because we tend to treat them far sooner than that. If, however, you left your cataracts developing for many years, there is a possibility that the degree of clouding in the lens is so much that you might not be able to see anything at all. My advice, as always, is to see an eye specialist and have a discussion about the possibility of cataract surgery when you feel that your vision is becoming impaired. So at this stage, there are no other treatments for cataract formation. There is no eye drops that have been shown to reduce or eliminate the formation of cataracts. No medication exists either. So the only form of treatment is surgical treatment with cataract surgery. So cataracts are indeed treated on the NHS. You are perfectly entitled to have cataract treatment on NHS services. There are some authorities, however, these days that ask for your eyesight to be at a certain level before considering you for cataract surgery. So it's important to be aware what those limitations might be. But of course, people are entitled to NHS care, and you should always explore that option as part of your discussions. So private treatment for cataract surgery is of course available, and the advantages are numerous. And in fact, first of all, you can be assured that you're going to be seeing the same surgeon both for the consultation and for the surgery, and of course for the post-operative assessments as well. This is something that's quite hard to achieve in a typical NHS service. Secondly, you're not going to be waiting very long for access to treatment. So the typical patient, for example, who comes to see me on a private basis, we will normally be able to schedule cataract treatment within about 2 weeks of making that assessment. Both eyes can be treated within about a week of each other. Therefore, both eyes can be treated in a very short space of time. Whereas typically in the NHS, unfortunately, many times you have to have one eye treated and then you have to go back on the waiting list for the second eye to be treated. So it can be quite a long and arduous, drawn-out process for some patients. And the final major benefit is that we can consider the possibility of custom cataract treatment. That means working out a solution that might allow you to live your life without glasses or contact lenses afterwards, both for far vision and also even for reading vision as well. So it's certainly worthwhile considering the possibility of private cataract treatment if you are able to do so. Cataracts don't have to be mature in order for them to be treated. The idea that cataracts have to be mature before treatment goes back to 30, 40, maybe even 50 years ago, when cataract techniques were much less safe and much less effective than they are now. With modern small incision treatments, with eye drop anesthesia, we can offer cataract surgery at a much safer level and much more effective. So please also be aware that these days there's a great deal of focus on driving standard eyesight. There have been reports, for example, the police officers are nowadays asking drivers to have their eyesight tested, and if your eyesight falls below driving standard because of cataract, for example, you could actually lose your driving license. So it's important to have these conversations with your optometrist, who can give you some advice about where your eyesight standard is. But please be aware that your cataract does not have to be mature to have surgery.